Hi everyone, my name is Arya Sadigan. I am a second year prospective pharmacology student at UBC, and today I'll be presenting to you pseudoephedrine. Some general information about pseudoephedrine. Pseudoephedrine is known as a sympathomimetic drug. So sympathomimetic drugs are a type of drugs that have a stimulatory effects on sympathetic nervous system. And as you may remember back from high school, sympathetic nervous systems sympathetic nervous system is the body's fight or flight response, which allows blood pressure, heart rate, and body metabolism to increase in situations where body needs to be fully prepared and active. So let's consider a case. For example, when you're in a really dangerous location and you want to escape, your body's sympathetic nervous system will be activated in such a way that it will allow the increase in heart rate and blood pressure for you to escape from that dangerous location. And I want to mention that pseudoephedrine is also part of the amphetamine family, and there are other multiple type of drugs such as methamphetamine, ephedrine, and many other drugs that are also part of the amphetamine family. And the key point I want to mention is that all these drugs are stimulant compounds which act on the sympathetic nervous system. So all these subclasses that I mentioned, including pseudoephedrine, are acting on the sympathetic nervous system to induce fight or flight response. And the reason why I bring this up is due to the fact that many of these drugs, including pseudoephedrine, have similar structures that are like amphetamine. So you have the benzene ring that are similar, you have the amine group that are similar, and there are small differences such as O that will cause small and minor therapeutic effects for each of these subclasses of amphetamine family. So moving on to the history of pseudoephedrine. Pseudoephedrine occurs naturally in certain plant species such as Ephedra vulgaris, as the picture shows here. So this plant species grows in most part of the world, but it is especially found in Central Asia. And regarding the history of how this plant was used, back many years ago, some Indian communities in Asia used this plant as a stimulus for cardiac muscle contraction. And it wasn't up until 1889 when two German scientists, or better to say chemists, first characterized and isolated pseudoephedrine from this plant, which led to major discoveries in the therapeutic effects of pseudoephedrine. And we have, I was able to only find one of the pictures of Albert Leidenberg, and we know that pseudoephedrine can be isolated from ephedra, but the key point I want to mention here is that commercially speaking, it will be partly impossible. So what pharmaceutical companies do is that they will isolate pseudoephedrine basically that is derived from yeast fermentation of dextrose. So isolating pseudoephedrine from plants will be kind of impossible because they have to have a lot of plants, and they will also need to purify all the pseudoephedrine and isolate it. So this will be kind of impossible. So what they do is they will just go with the yeast fermentation method. And lastly, I want to mention that pseudoephedrine has been out in the market since 1920s to cure cold and flu-like symptoms, and currently at the moment it is used in combination with other drugs such as antihistamine, guafenzyne, dextromethorphan, and acetaminophen in different types of over-the-counter medication that you may be using for your cold or flu to get better. So moving on to the mechanism of action of pseudoephedrine. So pseudoephedrine acts as an activator, or in other words, it is agonist of alpha and beta adrenoreceptors. So I have the picture here. So alpha and beta adrenoreceptors are present in different parts of the body, such as heart, lungs, and most blood vessels. And once these adrenoreceptors, these alpha and beta adrenoreceptors are activated, what will happen is they will initiate the fight or flight response. So what they will do is that they will initiate the sympathetic nervous system. So as you can see in the picture here, the presence of adrenaline and noradrenaline will activate these alpha and beta adrenaline receptors to cause different sympathetic responses, such as heart constriction, dilation of bronchi, and vasoconstriction of arterioles, and some other minor sympathetic symptoms that are mentioned on the bottom here. So we want to focus on pseudoephedrine. And so in the case of pseudoephedrine, pseudoephedrine binds with the alpha adrenal receptors of so we have the alpha adrenal receptors here, alpha adrenal receptors of blood vessels to cause constriction of blood vessels. So what we'll do is that it binds to the alpha adrenal receptors on the membrane of blood vessels, and it will cause vasoconstriction. So the diameter of blood vessel will actually decrease. And there's a second scenario that will actually apply to pseudoephedrine, is that pseudoephedrine will also bind to beta-2 adrenal receptors that are located in the in the bronchi, and it will cause the dilation of bronchi. So at the end of the day, you'll be wondering, okay, how this drug is helpful in terms of the vasoconstriction and bronchi dilation. And this is a good segue to the next slide regarding the medical uses and physiological effects. So medically speaking, pseudoephedrine helps relieve the cold and flu-like symptoms such as nasal decongestion. It will help relieve the nasal congestion. So it is basically a nasal decongestion agent. So let's consider a case. For example, when someone catches cold, they might have difficulty breathing due to the swelling of nasal blood vessels, as a case we have here. So what pseudoephedrine does is that it's really helpful in binding with the alpha adrenal receptors located in the nasal blood vessels, and it will cause the constriction of blood vessels. So what happens is that it will vasoconstrict these blood vessels, and it will open up the nasal pathway so you can breathe really easily. And again, this is the main and major point of pseudoephedrine therapeutic effects, and there are minor therapeutic effects of pseudoephedrine in such a way that it can actually bind with the beta-2 adrenal receptors located in bronchi and cause the dilation of bronchi, which result in easier breathing. But like I said, the major therapeutic effect that people use pseudoephedrine for is basically as nasal decongestion. So we talked about all the medical uses of pseudoephedrine regarding the fact that it is a really good decongesting agent for nasal pathway. But there are, of course, some off-label uses of pseudoephedrine that are basically used for the treatment of urinary leakage or incontinence. So the on-label use of pseudoephedrine is actually good for treatment of uncontrolled urinary leakage, as I mentioned. And the patient who are affected with urinary leakage will actually consume pseudoephedrine. And pseudoephedrine, what it does is that it activates the alpha adrenal receptors and causes the smooth muscles of bladder to constrict. So in that case, when it causes constriction, it will increase the urethral closure, and you will have basically no leakage. So it can have some sort of off-label uses that people could potentially use. Moving on to the side effects. So there are some major side effects as I written down here. So the first one is insomnia. The second one is excitability, hypertension, tachycardia, and seizures, and hallucination, especially in high doses. But what I really want to mention here is the first four side effects. So the first four side effects are basically associated with the activation of alpha and beta adrenal receptors that induce the sympathetic nervous system to initiate the fight or flight response, as we talked before. So for some people, pseudoephedrine can be really an activating agent to cause all of these side effects. So regarding the dosage of pseudoephedrine, people should always consider talking to the pharmacist and doctor to make sure that they don't experience these side effects and they only experience the therapeutic effects of pseudoephedrine. So there are some situations where pseudoephedrine should be strictly avoided. And for those people who have pre-existing conditions such as diabetes type 2, pseudoephedrine should be really avoided because it can cause severe increase in blood glucose levels and excuse me, it could be really dangerous in that case. And also, for people who have pre-existing conditions such as cardiovascular disease, severe hypertension, severe coronary artery disease, they should also avoid taking pseudoephedrine because pseudoephedrine, as we learned before, it will activate the alpha and beta adrenergic receptors, and it will act on the sympathetic nervous system in such a way that blood pressure and heart rate will increase. So for those people who already have these sorry, my pointer wasn't showing up. So for those people who already have these three pre-existing conditions, what could happen is that they already have a high blood pressure, and pseudoephedrine can increase the blood pressure way more. So it could be really fatal, and it could cause really severe complications. And for these people with having at least one of these conditions, it could actually end up they could end up with having a stroke. And lastly, I want to talk about the drug interactions. And basically, for those people who are consuming antidepressant drugs for the depression, such as monoamine oxidase inhibitors or tricyclic antidepressants, they should also avoid taking pseudoephedrine because pseudoephedrine can have drug interactions with the drugs they're already taking. And this will actually result in a process called hypertensive crisis. And hypertensive crisis is really fatal for people who are already in the depression mode, and it could potentially cause death. So lastly, moving on to the recreational and illegal uses of pseudoephedrine. So one of the illegal uses of pseudoephedrine is basically in sports. And as we know, pseudoephedrine acts on the alpha and beta 2 adrenergic receptors to stimulate the sympathetic nervous system. And this can be really problematic in some of the cases where athletes may be intentionally or unintentionally use pseudoephedrine for example, the cold-like symptoms. And what could happen is that pseudoephedrine can actually result in an increase in their heart rate and O2 intake. And this could actually be advantageous for them because they can perform better in their sports. So what happened was that World Anti-Doping Agency actually banned the use of pseudoephedrine even for the therapeutic uses such as the nasal decongestion. So no athlete can have pseudoephedrine, and they should all test negative for pseudoephedrine before playing, especially in Olympics. And lastly, I want to mention that pseudoephedrine can have some sort of recreational, or it's better to say street uses. So pseudoephedrine can be converted to methamphetamine. A compound that we talked about is part of the amphetamine family. So this compound is basically crystal meth, that is a street drug. And people could actually buy pseudoephedrine and use some breaching and hydrogenation processes that are outlined by the Najeri method, a famous Japanese scientist who actually discovered the process that pseudoephedrine can be converted to methamphetamine. So because of this conversion and the fact that, chemically speaking, this process is possible, pseudoephedrine status of OTC medication is slightly changed. So it is still in the still an over-the-counter medication, and you could buy it without having prescription. But pharmacies strictly monitor that, and you can you need to have some sort of symptoms, and it is really restricted from person to person, and the dispensation rate is actually monitored by the pharmacist to avoid people from doing such stuff that happen nowadays in society. Well, thank you so much for listening, everyone. I hope you liked it. This is the end of my presentation, and I hope you learned something valuable today.